What if the medication your doctor prescribed years ago, the one you take every night without a second thought, were precisely the one accelerating the memory loss of someone you care about? I'm Dr. Ethan Cole, a cardiologist, and I've been treating elderly patients in my Miami practice for 24 years. And something I see constantly in my practice is this: patients with perfectly controlled hearts, but whose minds are shutting down faster than their age should allow. Because here's something almost no one tells you. The heart and brain share the same blood, the same vessels, and often the same medications that affect them both. A study from the University of Washington, published in JAMA Internal Medicine, found that certain very common medications increase the risk of dementia by up to 54%. Read that again, 54%. And most people taking them don't even know they're on the list. Today I'm going to tell you about 9 popular medications, grouped into 4 categories, counting from number 4 to the most dangerous of all, number 1. Don't go anywhere, because the information at the end could change how you or a family member takes their pills every night. But before we continue, if you think this video could help someone, like it right now, subscribe, and share it with that person you know who takes too many pills without asking what each one is for. It could be your mother, your father, your partner. One click from you today could save someone you care about years of confusion. Number 4. Stomach protectors, such as omeprazole and esomeprazole. These medications block stomach acid, but they also alter how the body absorbs certain nutrients essential for the brain, such as vitamin B12. Imagine this. It's like turning off a water tap thinking it only affects the garden, without realizing that the same pipe also supplies water to the kitchen. A German study published in JAMA Neurology, involving more than 73,000 people over the age of 75, found a 44% increased risk of dementia in those who use them regularly. I met a patient, Rosa, a 71-year-old retired teacher who had been taking her reflux medication every morning for 8 years without anyone checking if she still needed it. When we adjusted her treatment with her primary care physician, her mental clarity improved within months. That's the concrete action. Today, not next week, ask your doctor if you still need that stomach protector or if it has already served its purpose. And this connects directly to the next point, because these medications are often combined with another equally risky group. Number 3. Opioid painkillers, such as tramadol and oxycodone. Here we're not just talking about addiction, we're talking about the mind silently shutting down. A Mayo Clinic study found that each opioid prescription was associated with a decline in memory, language, and attention, and a 20% higher chance of developing mild cognitive impairment. It's not a coincidence. It's not bad luck. It's biology. I met Mr. Fernando, a 68-year-old construction contractor, who was taking these painkillers for chronic back pain. His wife noticed he started repeating the same questions every few minutes. We worked with his doctor to find pain management alternatives, and within a few months, he was back to his old self. The action. If you or a family member has been on opioids for chronic pain for months, ask about alternatives this week. Don't wait until your back pain becomes much worse. Number 2. Benzodiazepines and so-called Z pills for sleep, such as diazepam, lorazepam, and zolpidem. These pills promise a good night's sleep, but they may be robbing you of years of mental clarity. It's like borrowing money from the bank tomorrow to spend today. It feels good in the moment, but the bill comes later, with interest. A 15-year French follow-up study found that older adults who started using benzodiazepines had a 60% higher risk of developing dementia. 60%. Think about that the next time you pop that sleeping pill without a second thought. And this brings us to point number 1, the most important of all, the one that connects directly to that statistic I gave you at the beginning of the video. Number 1, anticholinergics. This group includes 3 extremely popular medications. Antihistamines like diphenhydramine, which many people take for allergies or to sleep, overactive bladder medications like oxybutynin, and tricyclic antidepressants like amitriptyline. These medications block a substance called acetylcholine, which is literally the chemical messenger your brain uses to learn and remember. It's like unplug the phone cord and wonder why the calls aren't coming through anymore. The University of Washington study I mentioned at the beginning followed nearly 3,500 older adults for years and found that those who use these medications cumulatively for 3 years or more had a 54% higher risk of developing dementia. I met Doña Margarita, a 74-year-old retired seamstress, who took an antihistamine to sleep almost every night for years. Her daughter once told me, "Doctor, I feel like my mom is slowly slipping away, and we don't understand why." When we reviewed her medication list with her doctor and found safer alternatives, her memory began to stabilize. Tonight, not next week, check the label on that sleeping pill or allergy pill you take almost automatically. Now tell me in the comments. How old are you, or the person you're thinking of while watching this video? Let's recap, because this is too important to forget. Number 4, stomach protectors taken for years without a checkup. Number 3, opioid painkillers for chronic pain. Number 2, benzodiazepines and Z pills for sleeping. And number 1, anticholinergics, antihistamines, bladder medications, and tricyclic antidepressants. Your body isn't broken, and neither is your mind. Knowledge is power, and the small, consistent decisions you make today are what define the next 20 years of your life. If this video opened your eyes, please like, subscribe, and share it with someone who needs to hear this today. As I always tell you in my practice, a healthy heart and a clear mind always go hand in hand. Take good care of yourselves, and I'll see you in the next video. Remember, the pill you take without thinking today is the memory you protect tomorrow.